Many of you saw the news yesterday with the shakeup within the GLP community, so I wanted to provide a little bit of a backstory because I've been getting a lot of questions. Do I think compounding is going away? What is going on? So let's break it down. So when these brand name medications were on the shortage list, the 503A and 503B pharmacies could produce these compounded versions of these GLP-1s. 503B pharmacy, we think of our mass production pharmacy. So it's FDA regulated. It's got federal, regulation there, a lot of oversight. These are big pharmacies. They can produce a lot and they're very good at what they do. And then you have 503A pharmacies. These are your patient-specific, individualized formulations, smaller scale, not federally regulated. They're more regulated on the state side. So once these brand name GLP-1 medications came off the shortage list, the FDA said that 503B pharmacies could no longer mass produce these because they're not in shortage. They were told to stop. There was really a push for these GLP-1 medications to be patient-specific and individualized. You had to personalize it in some way. That's where all of these B vitamin additions came in. These B vitamins were there to help with patient side effects and whatnot, but basically to alter the formulation to make it different than the brand's name. So basically, this is not new. So, the 503B pharmacies have been told to stop production. So that's not new. That's not a big surprise. I had a friend describe it as if, speed limit is 55, right? You are not going to go to jail every single time if you go 65, right? You can still keep doing it. It's risky, yeah, but you're not going to go to jail every single time. So these 503B pharmacies kept doing it. And just to further clarify, these 503B pharmacies cannot ship directly to a patient. So these are the suppliers for your telehealth companies, your med spas, your clinics, all of that. And a lot of times these 503B pharmacies will ship their supply to a 503A pharmacy for the 503A pharmacy to then distribute out to the patients. So yesterday, big announcement, BPI Labs, which is a 503B pharmacy, had to shut down. Basically, the FDA said, hey, we're going to start fining you per vial if you continue. And so they have decided to stop. Earlier this month, same thing happened with ProRx Pharmacy, another big 503B pharmacies. Both of these, the ProRx and BPI, were the two major 503B pharmacies. Now, ProRx had some other things going on, so, at that time it was unclear as to whether they were just a bad actor or whether this was really due to the stricter FDA regulations. But now I think we can safely assume, that the 503B pharmacies are basically done for within the GLP-1 space and told, not to continue production. So I think, with the 503B pharmacies not being able to produce GLP-1s anymore, I think this will definitely affect the GLP-1 space. We might not feel it right now because, the 503B pharmacies have had time to prepare and make such a huge supply and a huge stock that a lot of these telehealth companies and clinics are well prepared for this, and they have a pretty good supply to last them several months. As that supply starts to dwindle, I think we can start to feel the effects. The 503A pharmacies are the ones that are going to have to step up and really absorb this supply and absorb this demand. And I think, they're not prepared for that. They're smaller scale. They cannot mass produce like these 503Bs did. So, not a bad idea to stock up right now, just so you're prepared in case we see any delays in the coming months. I don't want anyone to panic. Compounding, I do not think is going away. It's just going to have to be absorbed more on the 503A side. So 503A, like I said, not federally regulated, so a lot more difficult to shut down. If you're looking for reputable and reliable options, head over to my profile, check out the resource I have there. I do have my recommendations that I have personally vetted. If you have any questions, just drop them in the comments below.